Assalamu alaikum, hello and welcome back to Let's Talk About It with SABIA KHATUN. Today I have two guests who will be talking about another very significant issue and matter which is not widely spoken of and needs to be having views and experiences shared for the greater awareness. The emotional impacts of alopecia and the treatments available out there. What is it that is right for you? And we will find out what is BDD HPT and how do beliefs and cultures impact body dysmorphic disorder. That's a mouthful for me. I hope I will be getting an insight just alongside with you all, my viewers. I'd like to take you all over to my guests. I have with me here Anouska Cassano, who's a director for Hair Inc., a founder of ACT. We will find out what all of that means because I'm really intrigued myself. And amongst other things, Anouska, welcome to the show, but I will ask you to tell us a little bit more what you do because there's so much more that you are involved with. So welcome to the show.
Thank you very much. So I'm Anouska. I specialise in medical micropigmentation, which is not to be confused with body art tattooing. My route to expertise is we're kind of focusing more about hair today.
So we will come back to more details,
Sorry.
which I would just quickly like to introduce our next guest. Her name is Arucha Choudhury, and she deals with organic herbal things. So she is known as an organic herbal therapist, and I just love the word organic, and I hope that we will learn much more about it. So welcome to the show, Arucha.
Thank you very much, SABIA, for your invitation me. Very short invitation, but because this is my duty to become and join with you, and we can talk about the
important things today.
Yeah, it's okay.
Brilliant.
So thank you so much. I'm Arucha Choudhury, herbal organic therapist.
Yes, which we will find a lot more about, hopefully towards the show as we go on. What I would like to do is take you all over to Anouska. Anouska, could you kindly tell us a little bit about what it is that you do, and more importantly, briefly, if you can tell us what is alopecia, and if you can give us an insight into that. But just a little bit to let our viewers know what it is that you do and what do these fancy abbreviations of your title mean?
Yes, indeed. So I'm a medical tattooist, which, as I was saying, not to be confused with body art tattooing. Body art tattooing is art. What I do is simulate nature. So my background was working all over the body. I developed an expertise within hair because of the diverse patient range that was being referred to me. Alopecia is a broad term for hair loss. The more usual suspects that you will hear about are things like androgenetic alopecia, which can be it is genetic pattern hair loss, either for males or females. You have alopecia areata, which can present anywhere, bar bare in the beards, but in the hair it will present as patches of hair loss, but again, actually post-COVID, I'm seeing a lot more extreme alopecia areata, where actually rather than there being just losses of hair, you have pretty much total hair loss and very few hairs remaining. It's an autoimmune condition. There's also something called telogen effluvium. You also have anagen effluvium, but that tends to be post sort of cancer or medications. But telogen effluvium can be environmental, so diet, hormonal. There's also scarring types of alopecia. So, alopecia, broad covering title, and then you've got lots of different things in between. Most of them are autoimmune conditions, but also can be helped with kind of dietary and herbal attention as well.
Well, I just wanted to ask as well that you are a chairwoman for British Association of Aesthetic and Medical Micropigmentation.
Yes, that's a mouthful.
That's very fancy. How does that involve with, what you do?
Okay, so with the medical tattooing, again, when I first started, there were only two kind of routes available. So you had the permanent makeup side of things, or if you're putting it in a medical setting, that could be facial feature reconstruction. Also things like areola and nipple tattooing. It could be vitiligo, so skin conditions. You know, again, the hair side of things, which is probably the newest and more, if you like, commercial branch of
Well, the
this.
scalp part is your skin as well, isn't it?
It is, but it wasn't a standalone treatment. So most people, when they ask me what I do for a living, I usually refer back to permanent makeup, because most people kind of have got used to the idea of people tattooing on their eyebrows or maybe doing lips or eyeliners. That's then developed into more of a commercial expertise. But also when that came to market, it was very much, you know, that I'm a pioneer actually of scalp micropigmentation within the UK. There's a couple of other companies that I shan't mention, but our routes to expertise were different. The other companies came to market saying, we do bald men, Bic razor all your hair off, and that's what we do. My expertise has come through the medical side of things, so I've always developed treatment plans that reflect the individual, because in my opinion, you know, it's not going to be a successful treatment if you're not bridging the gap between what people see and how they want to be perceived. And if we're looking at women again specifically, you know, we've touched on it, the kind of cultural implications, the religious implications, even if you're looking at terminology, you know, even within kind of Christian.
We will come back onto that. I'd like Arucha to tell us a little bit about how, I mean, basically what it is first that you do. What does it involve? The fact that you come from the herbal treatment side of it. Can you tell us a little bit about what your role involves, and you know, how can we connect that with alopecia and you know, a few things related to that?
Thank you so much. Yeah. Well, first thing is I'm a herbal therapist last 21 years. So first thing, I never ever touch anything before that, which is herbal anything. Which, well, we do, yeah, yeah. So what's basically happened is I had a cesarean that time. You know, my son is 20 years, so I got very good. You know, so the time I got emergency, they took the cesarean because his court gave they said within the 5-10 minutes they have to do the cesarean, which was everything was fine before that. So that time, next day when I gave birth, and then the next day my doctor said you will get something is very strong side effect, which is for the you know, emergency drug we give you. So I said that's fine, but within 6 weeks I lost my hair like that.
Yeah.
Can you imagine, within 6 weeks, which is my hair was longish and hair long, thick hair.
Did you know why you lost it?
Yeah, she said it will be some kind of very strong side effect, but we don't know what will be the side effect.
So they didn't mention hair loss?
No, she said anything can be happen. So, but it is because we have to save mother and child both. This was my issue. So within 6 weeks, I lost my hair, and my whole house was like a rain of the hair. How I was losing bath, kitchen, bedroom, sitting room, everywhere I can see hair raining. How did that make you
feel?
So that is really touched me when I lost my hair. One day after 6 weeks, I just sit in front of the mirror and I say, Arucha, this is not you. This is not you. You have to do something. You have to stand up. You have to do something. So I went to the kitchen, and whatever I find, I just applying and putting as well, making things as well, because always I like to create something. Even though making something myself, I feel more happy, enjoying. So even I know that time I'm in a maternity leave, I got plenty time, I'm home, I'm the mother of another child as well, so I can do something. So I was making so many things in my kitchen, whatever I find as well, I was just putting this. God knows I don't know nothing about it, I got nothing, no experience. But all I remember when we was very young, when we was going to Bangladesh, my grandma was giving all this for hair or if any kind of anything. So she was giving us lots of the planting things as well. So was my faith, so I can do something.
Yeah.
But I was doing kitchen was doing. After 6 months later, I can see hairs stop falling.
Yeah.
This is nothing, but hair stop falling. But I don't know what is it and how it is. When I saw hair stop falling, I noticed straight away what I did, I just got a white bed sheet, I put it on the floor, straight away I sit on the bed sheet, I'll start combing my hair as well with a brush and comb both. And I was doing as well. Before that, I clean my brush and hair, comb as well, to test out as well.
Yeah.
So then I saw, wow, it's not falling. So that day I said, no, now I have to see if it is, what is it?
Yeah.
So 1 week I was just testing in a bathroom, kitchen, everywhere. Before I go on brushing or bath as well, before I go shower, I was used to clean properly as well to not to, and then I have to see, is it any hair? Is it any hair? Yeah. What is it? How it is? So that is how it was my first. After 2 years later, I get my hair. I'm just making it a bit short. After 2 years later, I got my stone.
Go back to, you said there was a plant-based thing that was given to you. Was it something you applied or you ate, or if you could share with us?
That's it. I apply and I ate food and drink. Well, I always used to eating what kind of like a vegetarian kind of food.
You were like a living experiment.
That is
With
that
us,
is I can say. Yeah, so I was eating all the good things, because first thing it was I'm the mother of the children, so I have to eat a good food as well, otherwise I can't look after
them.
the
That's what inspired you to do what you're doing today.
Yeah, so that's where, what is it? Another thing is, well, let me point it out. That time I was looking for it. What is the exactly what I'm using it? So my mind came that time, let's see which one is better. One other thing, that time I was getting lots of sun, I'm not good at makeup and this and that as well. As soon as I go out, if I want to go out, I just go out. Not like, okay, I'm just
doing makeup.
No, makeup still is
not with a young baby either.
Who's
got time to do that?
No time with, you did have a little baby as well.
So I was get like a black mark and all the pigmentation sort of things like, but when I was using that products in my hair, where I was applying, I can see the side of my hair, the skin is really bright, and in the front bit is quite dark. So I noticed that. Can you relate
to that, Anouska, like what Arucha is sharing with us?
Absolutely. So as I was saying earlier, the allergen or anagen effluvium and telogen effluvium, there are two things that can happen after a traumatic experience. That could be, as I say, dietary, it could be medical, it could be a side effect of anaesthetic. The anagen effluvium tends to be post-cancer, or it could be by the emergency medication given. Because it's not considered life-threatening, sometimes the support around, the devastation, you're overwhelmed, you've had a baby, hormonal changes anyway. We've got, menopause. We're complicated as women because we're the giver of life, and,
you don't know
internally. Absolutely, as well as environmental. So absolutely, what you're discussing, is not everybody's story is individual to them, but it is one that I hear a lot. Right. And also the lack of support and the quite blasé attitude sometimes from medical professionals, because it's not considered life-threatening, or it might be considered as an aesthetic problem. Actually, it isn't. It's a huge emotional problem. If you don't feel like you you stop connecting with people. You know, you had a baby, it's overwhelming. There's pressures on mums anyway to get things right. Plus, I think there's a lot of guilt as well about worrying about what you look like, and you know, the hair falling as well. Just for viewers to know and not panic, it is normal to lose 100 to 150 days hairs per day.
Well, we've heard from Arucha, one of the causes that, you know, caused you to have your hair falling out, you know. Are you able to mention any other causes you think or you know of that can cause?
Other thing is, once I learned the thing as well, for myself as well, and I find is very happy. And surrounding me, my family, friend, neighbors, whoever saw, they say, wow, wow, wow. First they were saying, oh, why are you losing your hair? They was questioning me. So it was
visible.
you know, it was just tuck me is like deeply, or why my hair is
You didn't
falling.
wear your headscarf then before? I'm assuming.
No,
Okay.
no, no headscarf, but that people see, you know, my straight, but just like that, my hair is falling. So everybody say, okay, because my baby, you know, that's how we make an issue, you
That's
know,
how
because
everyone...
of the child as well. But so okay, but I was doing it my things as well indoor as well, so hair grow as well when I start. And after 6 months, I can see the hair stopped growing in. After 1 year later, I can see the hair was coming and coming. So it's make me more, you know, boosting as well. So wow, I can do the confidence as well. So that time I was researching as well. Okay, put this product, they make that, this one bring from that one, put it back as well. So that's how I was.
So you understood different things.
So I know exactly which is what as well. I said, let me just do it as well. I'm home, doing nothing, no working as well. So as it was before, was full time. So it's okay. So then I find it's more confidence to doing it. After 2 years later, people can hold my hair and then can do the swimming as well as around. That's how strong my hair can grow. My hair
because you were not giving up. And
no.
I mean, my next thing I wanted to mention, maybe.
Sorry, I was going to say, through pregnancy, how did you look after your iron levels? Because iron is something that impacts women across the board, but also had a huge impact on hair loss. So was that something, you know, that you were aware of?
Iron is, Anouska, one thing, iron is my iron level from my childhood, my iron level, because I'm not very good an eater. Because, you know, people just go in a time to eating as well. But I'm not good at it. So if I got something, like as an example, I can say, even this morning, I had breakfast 7 o'clock in the morning, but still I didn't eat anything, but I can drink as well. So like this, I'm not a fooder. So if I got something to do, I just forget about my food. You know, some people just eat. No, I'm not.
That's me.
So that's how it is.
Well,
so
I'm
because
a grazer, if that means anything, you know.
I do, but that's a big portion.
And the other thing is, if I see some kind of something, I don't know, food is not my this as well. So my iron level always come down. So what I do, I make sure I drink water. I get lots of fruit as well. Fruit I do eat. Fruit. If I see the fruit and veg in front of me, I can't stop myself. That's it. Another thing. If I see burger, chips, okay, chips, okay, 1 or 2, but there's this chocolate and these. No, this is not me as well. So those are the kind of things I avoid. So my iron level, I make sure I can drink water, drink a milk as well. I make sure my iron will be high as well. So iron and vitamin D, not only me, I always, any person, anybody if surrounding me or walking around anywhere I say make sure you can take your iron tablet, make sure you can take a fruit, juice, whatever.
So it sounds like your vitamins are coming from the fruits, you know, and I think you feel sometimes when it is down that, hold on, I have to eat something. Although you're not constantly thinking, I have to have full breakfast, full lunch, full dinner.
The fruit, nuts, vegetable, these are the things always kept.
And it's important to have the vitamin C with the iron. So
iron and vitamin C.
So were you more aware that if you don't keep up to these nutrients, that can affect your hair.
Yes, that's right.
Yes.
Yes, that's right. That is the
yeah.
thing as well, is affected
That's
a lot
important.
as well.
And that's what people don't
First
always
thing,
realise.
this is the food affected, because our beauty is not just a beauty from outside.
No.
Our beauty is inner and out.
Right.
Both way the
Absolutely.
beauty will come. Whatever we eat and drink, whatever we consume, and this is it's come out, a glow in our face, glow in our hair, the body as well. And we women, we must look after ourselves, because we are the mother, we are the wife, we are the whatever is. I normally say to people, we are the root of the tree.
Yes.
So make sure if there's roots, don't get water and food and water, or the fertilizer, proper fertilizer. You can't see the fruit, healthy fruit
Yes,
as well.
exactly.
So that is how I give everybody the tips. Doesn't matter who I met, who I see, because I'm always chatterbox as well. So I just got it. So I make sure as well.
Yeah. Can I ask Anouska, what is BDD and HPT that, you have that background, if you can give us a little brief insight. And then what I would like us to do is just to see how it can connect with beliefs and cultures. And we've had even Arucha who, shared a beautiful story.
And a really relevant one.
And
which
a very
affects
brave
a lot.
one, I must say.
Yeah.
So, we can already see there are emotional impacts in that. So could you briefly tell us a little bit about BDD and HPT and some of the connections with beliefs and cultures?
So BDD is the abbreviation of body dysmorphic disorder. Now that can be a compulsive disorder, but without going into the medical science, because I'm not actually a medical person, but how that translates is people will focus on a physical attribute. Again, we'll keep it hair based, just because that's the nature of and topic of this program.
Yeah.
But it's any physical attributes. People will then have a distorted view, so they will obsess. They may feel, but very often they feel ugly. Prior to a little bit more being known about it, people would quite often accuse people of being vain. And that's actually one of the main things actually that I end up talking to people when they come to see me, when they say, well, I'm not vain. And again, it's like, this isn't about vanity. It is about how you connect with people. And going back to the point, my job is to bridge the gap between how people perceive themselves and how they want to be perceived. Ethics does come into it. I mean, there's lots of famous figures, or Michael Jackson, or people who definitely, I would say, would have had body dysmorphic disorder with the focus on certain attributes. You have to take a step back, and absolutely, what I do is aesthetic. So I aesthetically mask or improve the area. I actively encourage people to not just look at the outside, but to also have a look on the inside. And that would be emotionally, that would be through diets. You have to, without any pun, you have to tackle the root causes. And what I do is the external causes. But again, there's a correlation. There's a reason why they teach cancer patients to put makeup on. What you see directly affects how you feel on the inside, but it's not exclusive from one another. You need to take a look at the holistic view. Yeah. HPT is my trademarked way of working, which is hair pigmentation treatment. All of us, they have lots of different, the pioneers, have their trademark ways, and there's a broad banner, which is scalp micropigmentation, which is pretty much, a universal or more universal term. But it's really, again, just to distinguish ourselves from body art tattooists, because they're different.
Okay.
One's permanent properly. Mine is permanent with maintenance, but legally anything over a year is deemed permanent.
Brilliant. Wow. We're almost coming to the end of our show, and I know there's lots more we can cover. But what I wanted to find out, we've discovered from your own experience that hair can grow back, but can women become bald as well?
Yes.
Maybe Arucha can say something, and then you can add something else onto that, Anouska.
Okay, so Anouska, I come across quite a lot of women and the men, which is alopecia, which is just a patches in the hair is coming out from their hairs as well.
that's
Lots
the
of people,
common
one as well.
That's alopecia areata.
Okay.
Yeah, so I do give them as well. So quite a few people, when my clinic was running as well, so I got people came and I did treatment as well. Now I just give them whoever call me for the alopecia and things as well. There I just said this you can use it. So so I go through with their diet and everything, and then I just send them everything full pack. So I say do apply it home now and continue as well doing it as well.
Is it different for different people? Do some of them not have any hair grow back, or
Yes.
and are there some that because there are questions people ask, well, will my hair grow back again?
Yeah, there is hair grow back
There's hope.
again, because
That's what.
I can see, to be honest, if somebody wants to do something, they can do something.
But they need
have
to find the
they have to
right
find.
treatment for them. Would it be the herbal? Would it be the conventional? How do they know which route how to go about that?
It's the personal choice, isn't it, Anouska?
Well, it is personal choice,
Yes.
but I think that the biggest question is how do you get unbiased information, because losing hair can also be the quickest way of losing money, and unfortunately not everybody is ethical. So you have dermatologists,
And at the same
you
time,
have
sorry to
trichologists.
interrupt, losing the confidence.
Exactly.
Yeah.
And people prey on that. So that we were discussing earlier, I'm not anti most treatments, but I do find a lot of treatments are mispositioned or missold. What happens then, people are not just investing financially, but they're investing emotionally. They have no other ways. Maybe culturally, they don't feel that they can speak to people. I have a lot of hijab-wearing Muslim female clients. The stories that I hear is when they're in female company without the hijabs, they're feeling very judged. Sometimes it might be post-marriage or within a marriage, they don't want to disclose to the family or wider circles, because there's a huge correlation for women, whether you're Muslim, covering the hair, obviously the biggest beauty indicator, or even if you're Christian, phrases like crown and glory, which actually has a very strong biblical roots, all the way through to Disney, all of whom depict women and their femininity through long flowing hair. And if you don't have that, if you're not hijab wearing, if you have short hair,
very
people
thin
think,
hair.
well, people think you're either,
That's not beautiful.
No, or you have cancer, or there's something wrong with you. So the pressures on women are exponentially more layered than it is for men, and that's not diminishing how men feel, because I have a lot of male clients who don't take their hat off, they wear hair systems, they're not engaging with people, they're not having relationships. But the source of information is key. It needs to be unbiased. And I'm going to say this to people, a consultation is not just where someone's talking to you about what it is that they do. That's a sales pitch. You want to be engaging with someone who is going to look at your situation, take a holistic view, which is also going to involve, herbalists, it might be dietitians, there may be a medical aspect to it, but they're going to find out what your drivers are, what your sensitivities are emotionally, and then they're going to have a look at medically what type of alopecia, because it isn't all the same. There isn't a magic bullet. If you have androgenetic alopecia, which is a genetic pattern loss, that is a progressive condition in most cases.
Better to talk out, better to open your mouth and talk as well. Talk with a family, friend, whoever.
But not everyone has that.
And,
not everyone has that aspect. If they don't have the confidence. And GPs are great, but they're general practitioners.
Yeah, I mean, it's like, I think, do some people, I mean, if we're talking about women now, do they know who it is that will support them genuinely? Whether it's family, friends, colleagues, the emotion that they are already going through, the beauty, what they consider, who will actually tell them honestly, how it's, how are you actually looking? I mean, who will actually respect how you are feeling or what you are going through? Who do you surround yourself around with?
Well, I would say in the first instance, hopefully, if you have a sympathetic GP, go and have a full list of blood works. You know, in my clinic, when females actually come to me routinely, I will always provide them with a list of blood works to help the GP out. Sure. It's not exhaustive, but it will cover the usual suspects, all the way through to kind of private options. But it's important, again, given what I do, I mask the area. Ethically, I don't want to be potentially masking an underlying medical condition. That could be polycystic ovaries, it could be thyroid. It's not exhaustive, but there is a list. And again, holistic, we can tackle those issues. But do that in the first instance. Right. The NHS, again, be warned, ferritin levels, which is iron, has a huge impact on the hair. The range is 13 to 300. So again, sometimes people are going and getting tested thinking that they're within the realms of normal. They're not. That's impacting hair. And again, that's when actually a kind of broader investigation needs to be done.
Arucha, would you like to add anything else to that before we say goodbye?
Yeah. All I can say, you just questioning where people can we go. Yeah. But is my answer, I'll say first thing, whoever see this show, they should contact you. So you can be talk, you can be say, yeah, come here or talk. You can be give them more than what Anouska said. Yeah, they can go GP as well. Right. Sometimes people don't want to go GP.
It's who they would feel comfortable.
They don't feel comfortable. Right. But I will say, whoever wants to watching this show today, please, I'm viewer. This is not, I'm the one who are your sister. I'm a Bengali. My root is come from Bangladesh. And I'm the one who researched my product. And today in Britain, who gave me certificate, which is Herbal Organic Therapist as well, which is my certificate, one of the top certificates in the UK. And you can see I'm here today live to show you, tell you what is my situation was before. I was one of the who suffered before, and I made the medication. But you can be talked, you got lots of option, wide option. You can be going to GP, you can talk to SABIA and if you want her as well, say, okay, we can be go which way you can be. She can be give you advice. She can be sit down with you. I'm sure she will do. If today she called us,
I'm not sure how much I can, but at least I think we can all direct people in different
so its opinion is yours.
And also thank you for sharing your experience, which the viewers will see that there are various different reasons, and this is one of the reasons, and not to lose hope. If the hair is lost, that it can grow back, but it's choosing what would be right for you.
And also, if it doesn't, there are other things. Of course, the headscarves are one. You've got systems, but again, not everybody wants to do that if they want to jump in a swimming pool. So again, choosing the right solution, but also, masking, which is what I can do. But making sure that we're not masking anything. We can do things in combination. So while you're exploring, you don't have to lose confidence. Yeah. But sometimes you're not going to get the hair back, and it's also coping with that realization of how do we then change your new perception of you without you being the bald, woman that people are going to stare at. And that's a conversation, and it's a journey, and that takes honesty in a relationship. But you have to go to someone who is going to tell you the truth. Sometimes I have to be quite blunt with people and say, this is as good as it's going to get. Don't waste your money on anything else. The hair, once it's gone, it's gone. The only way to put a follicle back when it's gone is a hair transplant. Women's suitability is less than men. So again, it's a bigger conversation than we've got now.
Of course, yeah. I mean, there's so much more we can cover. But thank you again for coming onto my show and sharing, your very, very emotional experience with us. Because I feel, you will agree, it was a very brave thing to do.
Absolutely.
And thank you for sharing some of the knowledge about where they can go to, and I just really hope our viewers have gained some insight about it. So once again, thank you for your valuable contribution here.
Thank you very much.
Thank you very much.
Thank you. I hope you have all gained some insight into what alopecia is, some of the causes and some of the treatments. Not forgetting that there are many emotional and physical aspects that you will be dealing with, and your journey will be different from someone else's. What we have learned today is do research into what will be right for you, because it could be the herbal treatment, it could be the conventional treatment. Find out what would be suitable for you as an individual, as we are all different. We can say that beauty lies in the eyes of the beholder, but what I would say to my viewers today is that starts with you. Practice the gratitude, but most importantly, embrace you and be around those people who can see your inner beauty and who can uplift you and give you that confidence that sometimes you feel you've lost it all. This is SABIA KHATUN. Do share and follow VodTalk, and please get in touch with me if there are any other topics that you would like to bring on to the show, and we will have that put out. Thank you for watching. Stay blessed.